Thanks for joining us for this video, the 3 things that physical therapists should never be treating. Before we get started on that, make sure you hit the subscribe button so you get notifications every time we drop a new video here on YouTube. So let's get started. Number 1, physical therapists should never be treating tendonitis. Patellar tendonitis, lateral epicondylitis, medial epicondylitis, doesn't matter what tendon it is, you should never be treating that. Why? Tendons just don't wake up and decide that they're going to be irritated and swollen. Tendonitis is secondary or tertiary to other problems that cause overload and irritation of that tendon. So if you are directly treating tendons with ice, transverse friction massage, needles, electrical stimulation, ultrasound, you are completely missing the boat, you're wasting your time, and you're wasting your patient's money. Get to the root cause of tendonitis, figure out what that is, treat that, and the symptoms will go away. Number 2 diagnosis you should never be treating: herniated discs, degenerative discs, ruptured discs. It doesn't matter what the disc problem is, and it doesn't matter what their imaging says. If you are trying to treat a disc or unload a disc with decompression or stretching or traction or whatever the gimmick or gadget is that you're using, you are completely missing the boat. Disc compression, shear forces, degeneration is always secondary or tertiary to other things that are going on somewhere else. If you have disc patients coming in and you are trying to directly treat the spine or the disc, it's not going to work. The cause of that is somewhere other than the disc. So what you need to be doing is doing a functional screen to see how your patients move, where they are deficient in their movement patterns, how that can be causing too much compression of discs and shear forces on discs, and treating that. Once you cause those root causes to go away and you address that, you no longer have to waste your time chasing symptoms of a slipped, torn, or degenerative disc. Number 3 diagnosis you should never be treating: plantar fasciitis. Throw IT band syndrome in there too. Why? Connective tissue is never the root cause of the problem. So if you have somebody with plantar fasciitis, that fascia is irritated because, once again, somewhere else, some other structure, which is always neuromuscular, is not functioning normally. If you get to that neuromuscular dysfunction and you reverse that, you unload the plantar fascia. So the plantar fascia can be left alone to do what it's supposed to be doing instead of getting pounded on. So if you are rolling people's plantar fascia, you're icing people's plantar fascia, you're making the huge mistake of putting them in any kind of shoe insert or rigid shoe, you have just totally missed the point. You've made them worse, and now they're in this cycle of chasing the symptoms with garbage like ice and stretching and supports and all that stuff, which is going to eventually cause other problems, because people that wear inserts have eventually knee pain and hip pain and low back problems. So to cover up their plantar fascia problem, you just caused them other problems because you gave them a structural support that they do not need. Once again, evaluate them. Don't fall into the I need to follow this protocol, because everybody is going to be different. If you have 10 people walk in with plantar fasciitis, if you evaluate them, they're going to have similarities, but they are never going to be exactly the same. That's why they need to be evaluated individually. Once you figure out what they can't do with a functional screen, and then you break that down to neuromuscular components to figure out why they couldn't do that functional screen, now you have your answer of why that structure is being overloaded. Does that sound like the same thought process that we used for the disc issue and for the tendonitis? It is. Every patient that comes in to see you is coming in to see you because of the same root cause. Once you figure that out, your evaluation is really easy. Your transition from evaluation to treatment is really easy. Your transition from treatment to therapeutic exercise progression and patient education, actually educating them about science instead of nocebos, becomes really easy, and it's a streamlined system. If you want to learn how to do that with every single patient and how to avoid treating tendonitis and stop treating herniated discs and stop treating plantar fascia and IT band issues, you need to get down below and register for the MemberShift, and we will teach you how to change your career in less than 5 months and get results with every patient across the board, because you won't be chasing symptoms and wasting your patient's time and money.